Hello everyone, in this video we're going to be discussing why patients with emphysema have the clinical feature of pursed breathing. Now, the lungs are like a tree. So here we're going to see a bunch of branching, and this branching is ultimately going to lead to bronchioles. Now, when we are exhaling, the air is going to be flowing out of these structures. And at the top, when all the air is collected and leaving our body, as the air travels up, we are going to have these structures called cartilage that is going to make sure that the air does not pull on our bronchi so that our airway does not collapse. So sometimes when the air is leaving out, this bronchi can then collapse because the air is pulling on it. So in order to make sure that does not happen, we have cartilage that is preventing that. So when we go down into our bronchioles, so let's zoom into our bronchioles. Let's say that this is a bronchiole. We don't have cartilage to make sure that this does not happen. So when air is flowing out, it can drag the bronchiole with it. But in order to make sure that that does not happen, instead of cartilage, what we have in the bronchioles are these alveolar sacs. And through their elastic recoil, they're going to prevent the airway from collapsing. But with emphysema, what happens is because of the destruction of the alveolar sacs, we lose this elastic recoil. And as a result, the airway is unfortunately going to collapse. And so patients with emphysema, what they do is they do pursed breathing. And through this pursed breathing, they're going to create this backflow of pressure going back. And through this, it is going to then make sure that the airway does not collapse because it creates this outward pressure against the airway, against the structures of the bronchiole. And so that is going to make sure that the airway does not collapse.